Yeah, so thank you very much, Libby. I'd like to welcome our presenters today, Judy and Holly, and all of you for joining us. This is an exciting transportation series. I hope you caught the first of the series last week, which was a wonderful overview of sort of the ground rules in disadvantaged transportation, and then some examples of some really innovative models. A lot of information in that first one. If you weren't with us, please go back and watch it. It is available on our YouTube channel. And then in the second one, we're going to take a slightly deeper dive and look at some of the partnerships nationally that are occurring. So welcome, buckle your seatbelts for part 2 of our transportation series. Back to you, Libby.
Thank you. So just a little bit of housekeeping to let you know, we do have a Q&A box, and if you will put your questions in the Q&A box, then we will be asking those and presenting answers towards the end of the webinar. Also, the webinar is being recorded and it will be posted for view, and you will receive as a registrant for this webinar, you'll receive a link to it as well as a link to the slide deck. So all of that will be made available to you and will be posted on our YouTube channel as well. And also, if you don't have it already on your calendar, the third in this series will be on June 29th, 1 to 2:30 Eastern time. And you should receive some additional information about that since you're already registered for this one. So without further ado, I'd like to present to you and introduce to you Dr. Judy Shanley, who is with Easter Seals and the National Center for Mobility Management, and Ms. Holly Keenan, who is with Lutheran Social Services, who will discuss networks and hopefully get your brain gears going about how we can further build the networks across the nation for better transportation options for the people we serve. Thank you. Over to you, Dr. Shanley.
Well, thank you so much. Thank you, Libby. Thank you, Lee. And thank you for the Vision Serve Alliance for having us. This topic is near and dear to my heart, and I hope it will excite you, give you some ideas, stimulate conversation, help you build partnerships, because transportation underpins everything we do. So we're very excited that you're here. Next slide, please. And we can move on to the next slide. Today, we're going to be talking about our project specifically. Holly and I both represent different facets of the transportation work that's important to ensuring that everybody has a ride. So we'll give you a short overview of my project, the National Center for Mobility Management, and Holly will talk about her project in Wisconsin. We're going to be talking about something else called the Coordinating Council on Access and Mobility, which is a federal initiative which provides all sorts of opportunities for partnerships and funding. We're also going to be talking about what CCAM can look like at the state and the local levels. How can you take this federal initiative that sometimes seems far away to reach, and how can you implement that within your own state or your own region? Holly will be talking about mobility management and talking about it as an opportunity for you to further connect with partners and funders within your community and region. We're going to leave plenty of times for questions, and we also have some thought questions, some guided discussion questions that we thought we would ask you, because I don't know if Holly's the same way I am, but every time I do a workshop or presentation, I learn. And so I'm interested in hearing the really great work that you all are doing in the field. And then finally, we'll be sharing tons and tons of resources. I've included lots and lots of resources, knowing I'm not going to be able to talk about them all, but my hope is that you'll have this slide deck and the related links and resources as a resource that you can use beyond this webinar. Next slide, please. So I work at the National Office of Easter Seals, which is a national nonprofit organization comprised of about 70 affiliates nationally. I hope Easter Seals is a partner to many of you in your states. At Easter Seals, one of the lines of work we do is around transportation. And under that umbrella, I manage a national center called the National Center for Mobility Management. We are funded by the Federal Transit Administration, and it's a cooperative agreement. NCMM, which I'll call it NCMM for short, is a collaboration between my organization, Easter Seals, the American Public Transportation Association, and the Community Transportation Association. And essentially what our work is about is through national technical assistance, we help communities better coordinate all the transportation services that are out there and align those services with all the individuals that need rides. We help to build partnerships through various technical assistance activities. And we do that. The ultimate goal of our center is to build these coordinated networks called mobility management. And Holly will share with you in a minute what mobility management is, but our work really is about building the capacity of the field to implement mobility management networks. Next slide, please. So our National Technical Assistance Center, probably very familiar to other national TA centers that exist. We provide an array of free resources and supports. We develop products and tools. We have a blog, Mobility Lines. I hope that you all join our listserv so that you can get our monthly newsletter and you can access our blogs. We have also free online e-learning training modules that we hope you'll take advantage of. And we also have direct technical assistance. We've got a network of regional liaisons. We've got people that work across the country in the different Federal Transit Administration regions that can provide direct supports to you. So that's a little about NCMM, and I hope you'll access our resources after this webinar. Next slide, please. Holly, this is you.
So thank you for allowing me to be part of this effort and bring a little knowledge about what we've done here in Wisconsin. My name is Holly Keenan, and I oversee a program called Make the Ride Happen. We're a program of Lutheran Social Services of Wisconsin and Upper Michigan. So we're a nonprofit, and we serve presently 4 rural communities. And 2 of those communities have what I would call small urban areas where there is public transit. And our program came into an existence in 2004. So I've been doing this for a long time. Back then it wasn't called mobility management, but today that's the role and I've learned a lot over the years as well. And our program consists of a volunteer driver program that primarily serves older adults and people with disabilities. That's how I started out in the community in the Fox Cities. I'm located in kind of north central Wisconsin, a little bit south of Green Bay, Wisconsin, if you're a Packer fan. Our program also has a one-on-one travel training program with the 2 urban transportation areas that I serve. One of them has a very robust mobility management program in their house, so they do their travel training. But in the Oshkosh community, that program, we do travel training with them. And then one of our programs called Winnebago Catch a Ride is serving the disadvantaged individuals needing rides to employment. And that program was a result of an Easter Seals grant and some of the things that Judy spoke about. You know, we had a very nice community orientated group of people that wanted to make a difference. And then we wrote this Easter Seals grant. We got the grant in addition to the organizational part of the grant, allowing us to bring our partners together. We also got funding to actually pilot something. So our program, that Winnebago Catch a Ride, is a result of some of the things that Judy's been talking about as far as having the resources and bringing the right people to the table. And then lastly, we also offer another form of mobility, those of you that might know about this, but the Cycling Without Age program. We also own 2 trishaws, and we use volunteers to drive those trishaws. And we bring that out into the community to allow older adults and people with disabilities a form of mobility to get out and be part of their communities. So that's just kind of a general overview of my program. And then the next couple slides, can you go to the next one, please? We'll be talking more about my stuff going forward. So Judy, go ahead.
What's really amazing about Holly's work in Wisconsin is how eclectic all of the services are that she's offering. And that's exactly what mobility management is recognizing there's not one transportation mode for every person. Everybody's unique. And so there needs to be a range of transportation options for individuals and communities. And Holly will be able to talk to you more about each of those programs, but we wanted to give you a picture for the robustness of what we're going to be talking about. This slide talks about setting the stage, the rationale for why this is important. And I'm sure you're all here, and so this is not going to be anything new to you, but think about these tenets, think about these conditions or characteristics as you're talking to new partners, as you're developing funding potential. These are the reasons why it's important to coordinate and to improve partnerships around transportation. First, we know that transportation services are fragmented. There's a different transportation service for getting to work. There's a different transportation service for getting to a health appointment. There may be a different transportation service to get to a recreation facility. There's many different funders of those transportation services too. So you look at this maze of this network of transportation, you don't know who funds what, you don't know when the service is available, or even for whom the service is available. You know, some of the services are appropriate for older adults, some are appropriate for individuals with disabilities, some you have to be on Medicaid, others you don't. So it's a fragmented system. This creates a lot of inefficiency in service provision. I think of a story of a colleague told me once that in front of her apartment complex, there were 3 vans. There was one person in each van. One of the individuals was going to a day program. One of the individuals was going to an older adults program. And the third van had one person that was going to a veterans program. That's inefficient to have 3 vans with 1 passenger in each van. There's not efficiency in any of that operation. And also, accessibility is typically not built in. We're used to universal design and universal design for learning, where accessibility features are incorporated, integrated into a service from the get-go. But in many of these transportation services, that's not the case. There's also high cost associated with service delivery, particularly if it's inefficient. And the quality of service is sporadic. It's high cost and the quality is suspect. So that is really the impetus for why we're talking about these partnerships and coordination. And you all know this, there's gaps in service across people that need service, geographies, the rural, the urban difference between the availability of service. We know that that's a challenge. And there's lots of providers with little accountability in communities often. And so when we talk about the rationale, or we talk about the why is this important, these are some of the things that could be compelling for a funder, for a new partner, for an agency to consider investing in transportation. Next slide, please. The key to all of this, it's pretty obvious, is coordination. The solution, I always say, is coordination. We need to better coordinate the providers that are providing transportation services with the individuals and the agencies that are needing those transportation. Next slide. And this coordination, we're fortunate to be at a point now where there's something called, and I mentioned this, the Coordinating Council on Access and Mobility, and I'll call it CCAM. And this is creating a federal support for coordination at a state, regional, and local level. Next slide, please. So this, the benefits are associated with interagency coordination. And what the CCAM does, it's a federal impetus for 11 federal agencies to better coordinate transportation benefits and service. So you've got agencies like the Department of Health and Human Services, the Department of Education, Department of Transportation is leading the work, but you have these interagency coordination efforts going on so that the service as a whole is not as fragmented. And what this does, it increases the efficiency of service because there's consideration about whether it's an individual being funded by an HHS ride or Department of Labor ride. So it's creating efficiencies in the way vehicles are used. Accessibility is built in from the get-go in every mode of transportation. There needs to be accessible options, and it's increasing the availability of service because you're creating a lot more transportation options for an individual. And it's really streamlined the policies that are governed by each of these federal agencies to make the availability of transportation more plentiful. So that's the benefits of the CCAM work. Next slide, please. So here is kind of an overview of CCAM. The program is focused upon individuals with disabilities, older adults, and individuals low income. Originally, it was established in 2004 by an executive order, and these are the 11 agencies that are participating. I indicated the Department of Transportation was the lead and the catalyst for all this. HHS is involved, the Department of Education, Department of Labor, the Veterans Administration, the U.S. Department of Agriculture, HUD, Housing and Urban Development, the Department of Interior, the Attorney General's Office, SSA, and the National Council on Disabilities. So these were the original 11 agencies that by executive order were required to better coordinate. Next slide, please. And what has become of this is something called a CCAM Program Inventory. And believe it or not, there are 130 federal programs that can support transportation. And what that means is either they can purchase vehicles for an agency, they can provide voucher programs, they could offer volunteer driver programs, they actually can pay for rides for an individual. And there's a tool online, and I have the URL at the end of this slide deck, called the CCAM Program Inventory, which I encourage people to go through to see whether you have any of these programs in your community. If you have one of these grant programs, for instance, funded by the Housing and Urban Development, HUD, there's 12 HUD programs that could support transportation. If you have one of those in your community, your state, your region, knock on the door of those administrators of those programs and say, hey, did you realize that your program can support transportation? Many of the program administrators, unfortunately, don't know that their programs can support transportation and in what way. So this CCAM Program Inventory is an interactive Excel spreadsheet, can help you identify those programs that can support transportation. And I just encourage you to go through it, look through it, see whether any of those are applicable. Next slide, please. So we have this CCAM at the federal level. My center, the National Center for Mobility Management, works with states to implement CCAM at the state level. So we help Department of Transportation to better coordinate with Department of Health and Human Services, Department of Education at the state level, and also at the regional level. But to really make this operational, to make it actionable, to make it doable and practical, we also help implement mobility management networks. And the next slide provides kind of the underpinnings of what coordination and mobility management are and what are the conditions that facilitate its success. So this slide reads, the solution is to coordinate at the state and local levels, and coordination can work if you've got the right people and organizations at the table, but really transportation is everyone's business. So there's not any wrong person at the table. Usually when there's coordinated effort or mobility management network in a community, there's an action plan or a logic model. Some strategic planning goes on to help provide a roadmap for where you want to go and how you want to get there. Include objectives and outcomes and performance measures. So when you're trying to develop these partnerships at the regional, the local level, think about, where you want to be and how you're going to measure. How are you going to know that your partnerships are successful? Usually these structures, these networks have communication, governance, and clear decision-making in place. Usually these, when a community or a region has a coordinated plan or mobility management network, it's aligned with other plans that are going on in a community. Work with your regional metropolitan planning organizations or your regional councils to find out what other plans are they required to implement, because always there's planning that goes on, whether it's a public health plan, community health plan. Many states have active living plans or aging in place plans. Find out what plans are existing in your community and see how they address transportation, and if there's work that you could be doing together to further that. And one of the things that's also important is that the work is based upon actual data. So a community may do an environmental scan. They may do a needs assessment to find out what kind of rides are needed, where are people needing to get to and why. And then resource mapping, where you actually map the resources that do exist in a community. And it's amazing that people often overlook some transportation services that might be available, that may be part of this coordinated effort, but don't typically think about it. And finally, I think one of the most important things is that everyone shares the spirit to coordinate. There's a real silo breaking down, that people aren't in their jurisdictions because of how they're funded or the individuals that they work with. There's a real spirit to coordinate and share resources and address transportation challenges in a thoughtful way. Next slide, please. So good coordination leads to mobility management. I talked about mobility management is really putting the pieces together and it's on the ground. This has two arrows that talk about CCAM state policies and practice leads to results in implementation and mobility management network, which ultimately affect the efficiency and the quality and the policy around transportation services. So next slide, please. Mobility management is about getting your ducks in a row. That's the work we do at the national level, the regional level, and the state level. And Holly will be more explicit in terms of some of the practical things that she does. But really, it's about making sure that all your I's are dotted and your T's are crossed and getting your ducks in a row. Next slide, please.
So that's kind of what I hope to share with you of how we got our ducks in a row here in the Fox City. So I guess we started out, and I was the original employee when this effort started in 2004. And I was, asked to go into this community, take a look at the transportation issues and come up with a vision and mission statement. And that's kind of what we did here. That's my vision and mission statement. And this, program started out to be what I would call a call center, where people can call in no matter who they are and what their needs are. And then our staff here are charged with fitting them with the right program based on the existing services in the community. And we were lucky in the sense that we did have some resources here in the Fox cities, but once you get out into the rural communities, that's where it gets kind of dicey. But I was charged with looking at where the needs are, and then secondly, figuring out how we were going to fill some of those gaps. And we could do that because we were getting these calls in our call center all the time. And that's kind of where we started our work. Next slide, please. So really, mobility management is about collaborative relationships and building networks. And that's what, we started doing from day one. And, I started out really learning about what the services were in the community I was serving, and then networking with them. And each person that I spoke to often would have some type of need that maybe I could help with, or vice versa. And that's kind of where it starts. One of my first collaborative relationships was with something called Outagamie County Housing Authority. They have their low-income voucher buildings all over the county, and they had a full-time paid driver and a vehicle. And it was like, wow, how could we help each other? At the time that I started talking with them, they had some capacity. They were willing to work with me. Very collaborative. The person who was running the program was very collaborative, and she saw that in me as well, I think, and we started the collaboration. So she filled a need that I had at the time, because I have volunteer drivers who are using their own cars, but I couldn't help somebody who lived in a rural community who needed specialized transportation. So that's where the networking started. And to this day, we've been collaborating, and I think we're looking at a new collaboration in one of the communities I'm new to, because I see Outagamie County being part of that effort as well. So it can be an ongoing relationship. Another collaborative relationships we have is something called Fox Valley Memory Project. They have projects all over the area that I serve, but they're really trying to get into the rural communities, and they provide services to people who have early stage dementia in their families and caregivers. They provide some education to them, and then they also provide one-on-one case management and referral services, and they also offer some programming. And they came to me and said, wow, we really want to get some of our rural clients to some of our programs, but we're having trouble with transportation. So it was a natural fit. And they wrote a fairly large grant to provide one-on-one case management in the communities. And then we were part of that collaborative effort to help connect a volunteer driver and that rider to get to these programming opportunities. And it's a more one-on-one type service that we can provide an older adult with dementia, which is needed for them. So that would be another example of what we call person-centered transportation. The other collaborative effort that we're working on right now is working with economic development. And the fact that people who live in rural communities need to get to their jobs, but not everybody drives. And so we've worked very closely with Oshkosh Community Development and for many years now with our Catch a Ride program. But now we just recently started collaborating with Waupaca County Planning Economic and Development Program. And, they have a desire to get their employers happy with employees, and they want to get people to their jobs that are opening. So we're working together real closely on that. We recently looked at writing a grant, Wisconsin Innovation Grant, to look at maybe providing some kind of micro transit program in that rural community. And then our program would be the mobility hub, where people would call and say, I need a ride. And then we would connect them with the services that are in the community first. But then if there isn't something, then we're going to hook them up with another option. So, and then, like I said, our Winnebago Catch a Ride program in the city of Oshkosh worked all very closely with Economic Development Corporation there. They were a partner, not only supporting us with employers, but they too wrote a grant to provide some additional staffing time on their staff to assist with us in getting connected with the right employers and helping them see the value in providing this service so people can get to their jobs. So that they've been a very strong partner from day one, because they saw the need in their community. And then another example of a collaborative relationship we had is we have a very strong Hmong population in the Fox Cities, and something called Fox Cities Hmong Partnership. They had a desire to get some of their older adults into gardening again, because that's their background. And again, these people don't drive. They live with their families, very isolated. They wanted to get them out into the garden environment and get them gardening and doing things that they love to do to help combat depression. So they came to us and said, can you help us? One of the the gardening plots that they were looking to bring their older adults to was in a rural community. So there was no public transit for these people. So could we provide some volunteer drivers to help those people get to their gardening opportunities and combat some of that depression? So these are just some of the collaborative relationship that I was able to build over the years, and it's an ongoing process. Next slide, please. So how do we make the ride happen? Over the years, we've been able to show and demonstrate with the state, and we were able to actually purchase a Dodge Caravan wheelchair accessible, and we use volunteers to drive that vehicle. And that vehicle was purchased through 5310 funding, which I'll talk about more later. But the county provided the local match for that vehicle. So we use that vehicle basically to provide what I would call longer rides crossing county boundaries. Because everybody in our community, I'm sure you're seeing in many of your communities, they're not just getting their medical care right in town. They're going to where the best services are. And oftentimes that's going into different areas, crossing county lines. And so we use that van for that a lot. We have a great group of dedicated volunteer drivers that help us make those rides happen. I'm a little concerned about what's going to happen with the price of gas. Presently, our pool of volunteers that serves the older adults does not get paid mileage. So I am a little concerned about what that's going to look like in the future. But for now, I'm just grateful for the great number of volunteers who actually stuck with us during COVID. Even as long as they were safe, they were willing to provide rides because they saw the need. And then again, we always look at what existing services are out there first. That's always our go-to. So if somebody is living in the city, for instance, in the urban city, and they can use a public transit bus, that's what we're going to try and get them to do. And if they don't know how to ride the bus and aren't comfortable with it, we're going to hook them up with a mobility manager or a travel trainer with the public transit agency and get them comfortable with the bus. But that's not for everybody. But we are always going to go to those existing services first. And then when we find there are gaps, we see that as an opportunity to look at what other options might be available. And what we're doing right now in one of the rural communities that we're serving, there are no options. And what we're trying to do and what we found works is if we can find a need in an actual person, then we try to hook. That's how we build something. So if we have an individual who lives in a town that needs to get to their job, how could we do that? Could we find a volunteer? Could we use an existing cab company and maybe subsidize the ride? So sometimes those gaps are opportunities for us. Next slide, please. So I just want to talk a little bit about our Winnebago Catch a Ride program, because as I said earlier, that was a result of an Easter Seals grant and all the good things that Judy was talking about in her presentation. And so what we ended up doing, and this was a pilot program, so we built it from scratch, and it was a difficult process, but we had the right people around the table wanting to make something work. And that's really the important key. So we established the fact that when somebody needs a ride to work, we should be hooking them up with public transit first. However, in our community, we have a lot of paper mills and manufacturing. There's a lot of nighttime rides, a lot of early shift starts, and that's really where the gaps were. So we established a small volunteer pool of drivers who will be willing to do this kind of work. We were able to secure funding to pay them some mileage. And then we have a very easy scheduling software. So these volunteers can go out on the system, it's web-based, and just pull rides when they are able. So that's one way we're providing rides for some of those people. And they're paid mileage for that. However, when the ride is not picked up by a volunteer, then we still have to get that person to work, right? And a lot of our transportation gaps are right now, I would say 4:30 a.m. to 7 a.m. is one of our big gaps. So then we kind of have to use a taxi cab or another provider. So we have relationships with 2 other providers in the community we're serving. We established a relationship with them, and they have the ability to help us provide that ride. And then what we're trying to do, though, is keep that ride, because this is a disadvantaged person just starting out, maybe coming back to the workforce, maybe had some training, often financially unstable, but we want them to keep working, right? So we want to keep that ride cost effective for them. So we were able to find some what we call voucher dollars to subsidize that ride and keep it affordable. And what we try to do is we try to present this program as a short-term solution. So when they come in, we're going to help you for 90 days and you're going to pay 25 cents a mile to keep that affordable. But you need to start looking at long-term solutions. And for some riders, that's a good goal. Car loan programs, riding with somebody at work, whatever. But for some people, they are never going to drive. So then we have to find a solution for them. Presently, we're trying to present this as a short-term solution, but we're realizing as we move on that some of these people will never drive, or they have their license revoked for an undetermined amount of time. So we have to figure out a way to keep it affordable for them and yet keep the program sustainable. And what we're trying to do there is we're going to set it up where they can stay on the program, but they're going to pay a little more for their ride going forward so that we can sustain the program. Next slide, please. So yeah, as I stated, long-term sustainability is a big one. When you're writing grants, you have to be able to show that you have a way to pay for this. And I think some of the things we're looking at is ride sharing employment rides. If we're working with a particular manufacturer and so is coming into work anyway, if they took a friend or somebody that just started working with them and swung by and picked them up, they can get paid for their ride to work. So that's one of the things that we're trying to get the employers to see the benefit. And then we're also looking at having healthcare see the value. If we put a mobility management system in place and people are contributing, whether it's an employer or a healthcare, anybody can call and get a ride. But we have to keep it sustainable by having either the rider paying for some of the costs or other people sharing the costs with us. And we're always looking and always trying to find new collaborations. And sometimes you stumble on them when you're in a meeting one day and somebody says, oh, I have a need for transportation. And that's how you start building some of these relationships. And then, like I said, we are looking at some micro transit, working with some of our urban public transit systems because they're seeing that they need to get their ridership up. And if we can have some connectability between public transit and what's happening in the rural community, it's going to be a win-win thing for all of us. Next slide, please. Couple takeaways that I guess I would share with you from what the work I've been doing over these years is collaborating and working with other people is hard. They may come into it with an open mind, but when you start asking questions, oftentimes, that's where sometimes the network will stop. And what I always try to do is figure out a way where we could continue to work together and gain trust in each other and maybe move that arrow farther till, yeah, I want to start doing this. So, but that's dicey. Collaboration is not easy. And as I stated earlier, sometimes they're reluctant to even talk about stuff because they're often concerned about their funding. And so you have to keep that in mind also and show ways where working together maybe would help build more opportunities for both of us. But going into it, you just need to know you're going to get some pushback. And then the other thing I would say is that when you are in a situation and you're working on something, you can't ignore opportunities that presents themselves at the most inapt time. And I can say this from experience that when we were doing the pilot for Winnebago Catch a Ride, we had an apple fall in our face and we're like, well, do we ignore that apple or do we do it? And it's hard, but you really have to figure out a way to look at that apple right there and figure out a way to do it because it might not come back. And that's something I learned the hard way. The other thing I would say is small steps count. I know in all the work I've done over the years, I take one step forward and then the next day I probably take 3 steps backward, but I keep moving. That's the main thing. But the small steps do count. And then also I would say to you, working with other individuals, you need to adjust. And also you need to not be afraid to fail, because that will, I mean, you can have all the best intentions that A, B, and C are going to come in line. But you know, in the real world, that doesn't happen. But you can't be afraid not to try, because if you try, you can adjust and make maybe one little step, which is a step in the right direction. And then lastly, it's really important to have the right people at the right table wanting to work together. And if you have that, no matter how bad things get, things will work out. And again, that's something I can speak to in my own personal experience. Next slide, please. And then lastly, I think I was asked to kind of go through how the funding works. So my program has a lot of different funding mechanisms. And I must tell you that has created some anxiety within my agency, because I'm told I'm the problem child, because I have so many pots of money. There's so many local match requirements, different reporting, but somehow it works. I'm very blessed that leadership in this agency has entrusted this on me. But these are all the different types of funding resources that we've been able to string together over the years for this project. And because some of them are state and federal dollars, there are quite a bit of reporting that needs to happen. But the Community Foundation has been wonderful for us. We also have United Way funding coming in, and some local dollars. Fox Cities Greenways Foundation has been able to raise money for our Rationale program. And you know, it's complicated, and I would say this is a perfect example of what the term I hear now is braided funding is. This is our program as a reflection on that. And that's probably how we've been able to, you know, maintain our presence going forward. So I think that's all. On next slide, I think Judy, you're on now.
Yeah, thank you, Holly. I think one of my biggest takeaways from what Holly has shared is that you have to create value for partners. Partners have to see whether it's a health partner, a business partner, a foundational partner, they have to see the ROI, the return on investment for them. Why does it behoove them to invest in transportation partnership? And mobility management creates benefits in and of itself because you've got all these partners to the table. 27 states have organized mobility management networks. So I encourage you to find out, and you can do it through the National Center for Mobility Management. You can knock on the doors of your local transportation planning organizations. Find out whether you do have a mobility management network in your region or your state, because the benefits of shared funding creates more opportunities in terms of actual service on the road, making more trips available, being responsive to varying needs of riders, whether it's late night service, early morning service. There tends also to be greater emphasis on safety and customer service when you've got a coordinated network of service providers. It's multimodal. So as Holly pointed out, she used various modes of transportation because one size doesn't fit all. And that's what a network, that's what a coordinated network or mobility management network really is about creating opportunity. Next slide. I always say that this is kind of my mantra, that if you always do what you've always done, you'll always get what you've always got. And transportation innovation and thinking about new partners and thinking about funding, new and different funding. Holly talked about blending and braiding resources. There's increased flexibility for as a result of the Coordinating Council on Access and Mobility that allows different funded projects to be able to braid their funds. So this is an opportunity to really think creatively. And Be purposeful in the work that you do. Next slide. Here are just some suggestions for you in terms of what you could do with the information and next steps for you. Have conversations with your colleagues, your federal colleagues, the people that administer those federal programs that I talked about in your state, to find out whether any of those programs exist, find out how they could support transportation services. Learn about mobility management in your state. I saw that an ECO asked a question about local efforts to be involved in transportation decision-making. Every community has a coordinated, it's called a Human Services Coordinated Transportation Plan, sometimes HSC plans, that has to talk about how they're going to provide transportation and mobility services to a range of audiences. So knock on the door of your local planning organization and get yourself involved in that plan. They should be, by law, asking for input on that plan in the development of the plan. And by being in that plan, that could put you, if you're a human service organization, a nonprofit organization, you could be eligible for that 5310 monies that Holly talked about, which is a critical piece in providing human service transportation. But really knock on the door of your mobility management network, your metropolitan planning organization, and find out about local coordination efforts. You may want to undertake an inventory and collaborate to figure out the resources. Do you have a good handle on what transportation services exist? I remember going to an Easter Seals affiliate, and I went to their summer camp program, and sitting in the parking lot of this camp were 11 accessible vans just sitting there. And I said, well, what are you using these vans for? And she said, well, we bring our campers to the camp in the morning and we take them at night. And I'm thinking, wow, if that Easter Seals affiliate had worked with other human service organizations, those vans potentially could take people to doctor's appointments. They could take older adults to access groceries. They could help bring people to community recreation departments and housing departments in their community. So think about the untapped vehicles or transportation services might exist. Launch partnerships is a big thing, and helping, if you're funded by the Health and Human Services, Department of Health and Human Services, build partnerships with the Department of Veterans Affairs or the Department of Labor in your state or your region. Develop communication and informational blurbs across agency programs. I always think we speak to ourselves, right? We speak to the choir. Why not write an article about the need for transportation in a newsletter or publication produced by an agency or organization that's outside of the Vision Serve audiences, out of the typical audiences that your communications serve? Think about new and unique partners. Have informational meetings. There are usually existing meetings in communities, these coordinated human service coordinated meetings. Usually there's meetings already in place. So tap into existing meetings, but if there's not, then have a meeting yourself and invite everybody to talk about how to address transportation challenges. And then also invite Department of Transportation's or transit providers into any roles that you may have within your organization as an advisor. The more that people that aren't in our professional discipline feel engaged and knowledgeable about our work, the better able they'll be able to make decisions about funding and partnerships. So the next slide. Before we get into our conversation, I developed some worksheets for you all, and we'll share them after the webinar. But the first is a learning activity one, I called it. It's a worksheet around data and policy. One of the first things when you're thinking about transportation services is understanding the data that can drive decisions to implement transportation service, and also the policies that different agencies have regarding transportation service. So this is a worksheet that you could use with your colleagues to get a lay of the land about the data and policies. There's a second learning activity worksheet that looks at understanding transportation challenges and needs. It's kind of a needs assessment. These aren't the only tools. There's tons of tools out there on needs assessment. This is just something that I put together based upon our experience in working with communities around the country. The third is an environmental scan. I talked about doing a resource mapping so you could get a good picture on the kinds of transportation services that may be available. So this is a tool that you could use to capture all that information. And finally, learning activity 4 is a way to think about new or different transportation service. Holly talked about in her community, they're thinking about a microtransit service, which is usually a private for-profit or nonprofit provider that provides a more customized transportation solution as opposed to a big public transit agency. But this tool will help you think creatively about transportation service. So I think the next slide, it's time for our conversations and any questions that you have, and just love to hear. I have some guiding questions after this that we could go to, but first let's address some of your questions. Let's see. Anicio had asked, can you elaborate a bit on what kinds of local structures exist that may provide opportunities for advocates to advocate for more transportation? Well, I think I mentioned the human service coordinated planning that goes on. Those are existing meetings that they encourage the participation of different advocacy organizations. Also, transit organizations themselves may offer opportunities for advocates and human service organizations to be involved. So, contact your local transit providers, your transit planning organizations. Holly, do you have any suggestions to answer that question?
Well, I think any agency or service provider in your community that serves older adults and people with disabilities, I mean, they have, there's a lot of resources there. You could go to some of their meetings and find out what their issues and what their needs are. That would be another thing that you could do.
Wonderful. And Misty asked, as a visually impaired citizen, how would I go about utilizing mobility managers in my own state if I don't already know of options to get from point A to point B? I myself am in a very rural, small town area in southwestern Indiana with few options. And Misty, Indiana is one of those states I've been working with for a number of years to try to build their mobility management network. There are regional coordination councils in Indiana that could be a source for you. Those are entities that include transit providers so you can learn about your transit services in your community. I also know in Indiana, your SILC, your Statewide Independent Living Center, is very active in state coordination around transportation. So they would have some local resources that could point you to your local independent living council that likely has an inventory of some of the transportation services that you can use to get from point A to point B. Holly, any other suggestions for Misty?
I think, I don't know Indiana, but here in Wisconsin, we have the Wisconsin Association of Mobility Managers. We actually have our own association, and we have mobility projects all over the state of Wisconsin. And so if anybody on this call is from Wisconsin, you could go out to our website, wamm.org, and you'll be able to see where the projects are and who the contact people are. But I don't know that Indiana has the same.
Yeah, Indiana, unfortunately, is not as advanced as Wisconsin. Wisconsin has probably led the nation in terms of a coordinated system and having a mobility management network. And as Holly said, they've got projects all over the state. In Indiana, there's pockets. So the Regional Planning Council in Evansville or Evanston, Evanston, Indiana, is really amazing in terms of having an inventory of services that exist. Some of the regional planning councils in the north actually have inventories of what transportation exists. So I think number one, contact your state independent living center, who likely will refer you to your local independent living center. And then also your regional planning councils. And I know there are at least 6 of them in the state of Indiana, all over the state. So they would have an inventory of services, because there is not a mobility management network, but it's likely that people at the planning councils would have the capacity to provide you with information. Let's see, next question is from Mary. And Mary says, how can the vision and hearing challenge communities work with the mobility management network nationally to enhance services for people with these conditions, policy opportunities? Oh, that's a good question. So my center is always looking for input from individuals with disabilities and participants and people with lived experience. We have a grant program currently out on the street that you all could take advantage of. If you go to our website, you'll see the announcement on the front page, and it's a kind of a coalition building design challenge grant program available to communities around the country. And in those forums, that's an opportunity to influence policy. We work so closely with the Federal Transit Administration that sometimes the FTA and other agencies like the Administration on Community Living will come to us for the kinds of feedback and trends that we see from the field. So keeping in touch with us through our newsletter, by participating in discussions, by participating in any national forums we have. If we do national workshops or we have webinars, it's a nice way for us to hear from the field and to get input and then to convey that information to the powers that be, to change policy, to change practice. Because you're right, there at the federal level, there has to be policy change. And I have to tell you, this administration has been very welcoming of the voices of many. The current administrator for the Federal Transit Administration is someone who gets it, and she's very responsive to any comments from the field. So even if you go to the Federal Transit Administration website and look for opportunities there to lend your voice and to share your opinion, that gets listened to. That's what changes policy. Thank you for the question. Melody asks, given the multitude of eligibility criteria, accessibility barriers, insurance stipulation, age brackets, and income requirements, are there transportation advisory committees for consumers with disabilities and medical conditions which allow us to speak to advocates and public transit companies from experience? Similar to kind of Indicio's question and even Mary's question, yes, there are always advisory committees. You point out the challenges associated with the fragmentation of services quite elegantly, Melody. All of the different eligibility criteria, the different funding mechanisms, the who's eligible for what and when has created havoc. And we're seeing, because of the CCAM effort, we're seeing a lot more flexibility. We're seeing a lot more responsiveness in terms of transportation service. At the end of this slide deck, I've got some resources for the CCAM that is actually provides a place for you to provide input. And that's an opportunity for you to both speak to advocates, but also speak to the policymakers and the funders to continue to talk about potential solutions to all of this. But CCAM is implementing a strategic plan, and we're all hopeful that after how many years of doing this work, that there's going to be a more holistic view of, and not just view, but a holistic services. There's going to be more coordination across all of the different funders and policy organizations.
And if I can just add to that in the sense that don't forget about what you can do at the local level. I mean, my program is probably a perfect example of that. We have a healthcare system in this community who does what they call community health action teams. And they go into these communities and they assess a particular problem. And then they get all the leaders in that community to do what they call a plunge. And they go in, and that's how I was created. So this program, they identified in the Fox cities that it was very fragmented for an older adult and people with disabilities to find transportation that met their needs. It was, you know, some people knew a little bit about it. Some people knew nothing. Some people, and you get the runaround, they get phone call, you know, all pushed around. So it was felt from this plunge, this committee, that they would be best serving our older adult population by having one local person that would have all the information. So if a family member or an actual rider didn't know what particular service worked best for them, they could call our office and we would have that inventory and we would connect them with the right service. So, and that's how it was started in 2004, and it's just grown because, you know, people see how transportation affects all aspects of their life. But as many of you know, some people don't get it at all, and they won't get it until it affects them, you know. So we're always challenged on the local level to get people to see that in our communities. Until that person sees their mother struggle to get to their appointments, that's when they're going to get it, you know, as far as the policy part of it. So just
That's a great example. Really great. And, you know, a lot of this does start at the community level. I remember being in a meeting. It was with a large company in a very rural part of Ohio. This manufacturing company had just moved in, and they were being challenged with getting employees to their business site. It was off the beaten path. There was no fixed route transportation service, no bus service, no accessible service. And so we had a meeting. And at this meeting, we invited a lot of the human service organizations. We invited the planning organizations. We invited the local legislators. We invited the transit agencies, the transit providers themselves. And the employer said to the economic development people, and Holly talked about the importance of economic development, truly important. At this meeting, the company was talking to the economic development people, the local legislators, saying that if they couldn't get employees to their manufacturing site, that they couldn't stay in the community. And obviously the economic development people, the local legislators, didn't want them to move out. They wanted to be able to attract new businesses. And the only way they could do that was developing transportation service to this remote area. And they did. And they used it as a selling point in their Chamber of Commerce and business development to attract new businesses. There was another example. It was a western part of Pennsylvania, and there was a huge problem with getting people to healthcare appointments. A lot of rural, not a lot of plentiful transportation service. And so the transit agency convened a meeting of local stakeholders, so local advocacy groups, people for which this was a problem. They collected data, and they invited the hospital corporation, the medical providers, as well as the hospitals in the area, to be part of the decision-making on how to address the challenge. And the hospital corporation, it was Geisinger Health Service, actually contributed resources to develop a transportation service for the community residents so that people could get to the healthcare appointment both at the hospital and the medical area around the hospital. And that started very organically. It started with the transit agency saying, hey, you know, we're having a problem here. People need to get to medical appointments. But I have to tell you, healthcare providers want to be at the table because the Affordable Care Act, I don't know if you know this, but a hospital will get dinged monetarily if people, if there's recidivism, if people leave the hospital and then come back within a certain number of days, they get dinged, they get financially penalized. So there's a big incentive for healthcare providers to be part of the transportation discussion and innovation. And that's true for economic development people. I once went to a meeting and there was a local sheriff at this community transportation meeting, and I had never had a sheriff or any police officers at these meetings. And I said, why are you here? And he said, because if the people in my community are not working or they're not engaged in some meaningful activity because of transportation, because they can't get there, then they sit on the streets and they do bad things. And that has adverse implications for my workforce, for the police that are under me. I want to be at the table. I want to help figure out transportation solutions and all this. So, you know, it's just, it's organic the way some of this starts, and then capture it at the local level and communicate that across the state, communicate that to your state legislators and state entities that oversee the service. That's how policy change happens at the state level and ultimately at the national level. So I think we have more, do we have more questions? I think we answered them all. Libby, you see any more questions? Is there something?
Oh, you have wonderfully answered all of them. And I think we want to be sure and get to your questions, you know, for guiding discussion, and also the resources. And then we will begin to, if you can turn it back over to me at 2:25, then we will close right on time.
I certainly will.
Thank
Thank
you.
you for your questions. Really thought-provoking. And these are just some questions that Holly and I had for you. What forums or tools do you use to engage in planning and partnerships regarding transportation service? So do any of you currently participate in community transportation forums or any other opportunities to really affect policy? And I guess put it in chat. Anicio said, truly, transportation is everybody's business. I totally agree, Anicio. So none of you are involved currently in any transportation forums. Have you addressed any challenges, and how? Have you heard any of the, any of the solutions that Holly shared, anything that I shared resonate with you and saying, oh, we do that?
I'm going to open it up so that everybody can talk. So if anybody has anything, rather than putting it in the chat, might make it a little bit easier.
Yeah, and if you could raise your hand, please. And Ms. Osoria, and forgive me if I have not correctly pronounced your last name. It appears that she said this is her first one today with y'all, Judy and Holly. So thank you.
Thank you for being here. You see any hands raised? Not so much. It's an overwhelming amount of information, I think. And I encourage you, look through all this stuff, consider it in the context of your own setting, your own community, your state, and then make decisions what's appropriate. And if you have, we've talked about, and we'll probably talk about this at the end, some ongoing opportunities for dialogue. But, think about how you could apply some of this. Oh, Melody has something. She says, I participate in the Central Ohio Voice Panel and the Ohio State University Medical Center Disability Advisory Health Partnership. Transportation access for people with disabilities is a hot topic. Wonderful. That's terrific that the Ohio State, the Medical Center has opportunities for you to talk about transportation. By the way, Melody.
Unmuted. I meant to put Central Ohio Transit Authority voice panel.
Okay.
I'm kind of typing quickly. Yeah, it's you take surveys and we can get gift cards and things that are not accessible to apply for us for different stores online, but it's neat to get to participate. I don't always know if what we're doing is helpful, and the whole access to healthcare, transportation is a big part. And if you have multiple disabilities and they're specific as far as needs and capability, I now have no care team. After trying 5 systems, and I thought I might try to combat this speaking up, and it's kind of hard to do it single-handedly, but yeah,
Wonderful. Good. You know, Ohio is one of those states that does have a mobility management network. So hopefully you found some good colleagues in the state to help you. And they have an annual conference. Actually, I was invited in October to come to Columbus to help their mobility management network. So take advantage of that.
Judy and Holly, this is Anizio. Was a wonderful presentation. The information is certainly overwhelming.
Yeah.
I mean, just the issue is overwhelming. But I must say, because of some of your the information that I gotten from you, Judy, previously, I was able to actually just Google around mobility management, human service transportation, and I found that in fact in my community that is a group that meets on a quarterly basis, and that alone enabled me to begin a relationship with them and hopefully help improve transportation in my community. So as overwhelming as it is, it's worth getting involved in, and there are definitely opportunities for that. So thank you so much.
Well, thank you, Anicio. That's good testimonial that, you know, this can work. It, as Holly said, it's not easy and it's step by step, but finding the right people and helping articulate the challenge and the solutions is a viable to change practice. So thank you for sharing that. Let's see, and Kelly says he's going to check out CCAM to find inventory. Good. Go to use that program inventory, and I have on the next slide, I've got a link to it where you can find out what programs may exist in your state. Lori says no microphone, but okay, Lori, well, thank you for participating regardless. And Kelly says transportation is often not accessible to apply for people who are blind. I guess I'm not quite.
Yes, this is Kelly.
Oh, hi, Kelly.
So, in my experience, for example, the paratransit applications are not accessible. You can't apply online. You have to fill it out. You know, you have to print it out, fill it out by hand. And so that's not always accessible for people who use screen magnification or screen readers, or who can't print things out and can't fill out things by hand. The other issue is that here in Tennessee, transportation you don't have to apply for every few years, but I come from Florida previously, and in most of the counties, you had to reapply for services at least every 2 to 3 years. You know, even if your vision was not going to change, you were always going to be, you know, blind for the rest of your life, for example. So those are some of the barriers that I've seen, that things are not fillable and just overall not accessible.
That really surprises me.
And I can support what you're saying, Kelly. I see that in our community, and that's some of the things that my staff will help somebody in the family with doing those kinds of things. It's not an easy process.
I mean,
Yeah.
This is Melody.
we
I'm
help
sorry.
with that. We help them fill out the application, but they do need to sign it. So we do still have to, you know, send it to them. And, you know, but if there isn't somebody, you know, in VR services, or if they don't have the supports, if they're not a VR customer and they just need transportation, you know, there isn't always the availability or time for a VR counselor or an IL counselor to fill out everybody's application. You know, there should be more of an opportunity for them to be independent, to independently do that.
Mhm. Yeah, I'm really surprised that exists. I thought the ADA required there to be accessible formats for making the process accessible, not just the
This is Melody.
service.
I share that sentiment. I am totally blind with an additional spectrum of conditions. And we have to reapply for
Mhm.
the mainstream paratransit annually, and we don't always have someone available, or who we do are not the right people to apply. In the VR agencies that I applied for, I was actually a caregiver for a lady with severe TBI. It seems like, how could someone like me have done that? And I also went down to the CODA office to help her with her eligibility. I was not heard because I'm a permanent writer with my disabilities. And for both of us applying, it was difficult. And a lot of our healthcare forms are also not available to us. And it was just, having to depend on someone. And the VR, when I had tried to apply for the third time, the VR counselor said, we don't normally help people become one-on-one caregivers, but I personally want to help you save her life. And then I was not able to end up doing that. And it's kind of what we are thought of, and the types of jobs that we want to do, in the transportation that can help us out. It's not thought that we can do that. And we need things available so we can apply, or so some of the visual assistance applications can securely access those forms for us, and we can allow access without all these codes and screenshotting, so we
Mhm.
can.
Mhm. Yeah, I'm surprised that the process, well, I'm not surprised that the process is as cumbersome as it is. It is a cumbersome process, but I'm surprised that it's not accessible. And I've heard of increased flexibility by transit providers to minimize the number of recertifications that have to go on for paratransit. I can try to dig those instances up, but I think it came about because of people's disability. That's not going to change substantially from year to year, and it doesn't make sense for either the rider or the transit agency to have them go through that eligibility determination process again and again. So
And I can speak from my own personal with the two transit agencies I have. A lot of it depends on their leadership and how the leadership of the transit agency wants to manage it. Because we had one a leader at one point that felt that wasn't something we needed to be doing every year. But when the leadership changed, they went back to it. So that would be from my experience here in Wisconsin.
yeah, and I think having a meeting, maybe having a forum of individuals who feel the same way you do, with the transit agency, to talk about the realisticness of having to do that eligibility process over and over again, I think is a worthwhile conversation. And get as many of your peers and human service organizations involved in that conversation. So I want to be mindful of time. Jan just said that she sits on the Lake County Transportation Disadvantage Coordinating Board. I believe that's a structure that they have in Florida for informing public transportation. And she said that that's an important role to be in on that coordinating council. Definitely impacted positive changes just by speaking up. She said speaking up a lot, and now she's developing self-advocacy skills and clients and participating in boards. So yeah, those local coordination meetings, those public engagement meetings are a critical first step. So thanks for sharing that, Jen. This slide, the next slide, has some of the CCAM resources that I talked about, and the program inventory is there, and I just encourage you to go through it and see what's applicable in your state, meet the people who administer those programs and talk about the transportation services they do. I also talked about federal braiding, how there's increased flexibility. So using different pots of money to support transportation, like Holly mentioned, there's a resource that's really amazing that you can use to educate. It's part of this is education. Part of it is even transit providers themselves and planners sometimes don't know that these programs exist. And so helping them become aware of how they could use these resources is critical. On the next slide, I put some other resources that are available through technical assistance. On the next slide, please. is the technical assistance resources available through the Federal Transit Administration. All of these places have grant programs. So Holly mentioned the grant program that Easter Seals has. We have the National Center for Mobility Management has a grant program. RTAP has a grant program. So link yourself up to some of these national TA centers and take advantage of both their grant programs and their free technical assistance resources. The next slide, there's a national coordination site you could go to even learn more. Overwhelming, this is all overwhelming. And then the final slide has Holly's and my contact information. And we thank you so much for listening to us and to sharing your stories and information. And we encourage you to follow up with us and hope we can keep in touch with you. Thank you, Vision Serve Alliance, for inviting us to be here. Thank you.
Thank you.
Thank you, Judy and Holly, for this wonderful presentation. And to answer your questions, yes, this webinar has been recorded and it will be distributed. A link to it will be distributed to you in an email. And you will also have access to this PowerPoint presentation that does contain live links so that you can reach out to any one of this wealth of resources that Judy and Holly put together here for you today. And I also want to remind you of the webinar that if we can go back one slide, please. If we can, I'm sorry, forgive me, I'm looking at the wrong thing. I'm looking at my own screen instead of y'all. If we could advance to the one about the June 29th webinar. So we will, our next and last in this series of transportation webinars will be on Wednesday, June 29th at 1 p.m. Eastern time. It too will be recorded and slides will be distributed to everyone. Lee Nasahi, president of Vision Serve Alliance, was unable to join us to thank you in person for attending, to thank our speakers for their time and efforts in putting together this wonderful presentation that we're already getting a lot of good feedback about. So thank you everyone for your interest. You will be hearing more from Vision Serve Alliance because we are just in the beginning phases of discussing a continuing forum about transportation. I cannot answer any other questions about it because we don't know yet, but we have been asked for continuing conversation about this so we can help build networks on this. So thank you all again for your interest and for your participation today. And we look forward to seeing you on June 29th. Thank you so much.
This is Chuck. I've got a quick question if you have time.
Sure.
Okay.
Go ahead,
my
Chuck.
question is I would like access to those links. Are they going to be emailed to us, or is there, what website do we go to get those links?
The presentation.
Yes.
I'm sorry, go ahead.
With the hyperlinks.
Yes, the presentation will be emailed to you, and within the presentation are the live hyperlinks for you to be able to click on all of those resources.
Good. I want to share some of those with our city administrator, who's a friend of ours. So.
And where are you from?
Berlin, Wisconsin. It's a small community of 5,000 people.
Oh, very nice, very nice, beautiful area. Well, thank you, Chuck, for your for asking. And yes, to reiterate, the recording and the slides will be forwarded to everyone who attended here today. Thanks again, everybody, and we look forward to seeing you again very soon.